Welcome to another episode of Off Leash with Dr. Pete. I am your co-host, Molly Van Branken. We're so excited that you joined us for today's show. Remember, we're not here to say what you want us to say. We're here to be an advocate for your pet. I'm done following scripts today. We did filming earlier,
generally how I'm wired is I'm not ever going to say what somebody wants to hear. So it's I go home and I live up to that mantra. I never say anything.
You don't say anything that your wife wants to hear?
Not that my wife wants to hear.
Really?
Yep.
She was mad at you the other day. It was her birthday, and she said, I did not get a birthday check.
Oh, she got a birthday card.
Not a check? There was not a check in the card.
No.
Because you have this joke about how you take someone else's money back home to your wife at the clinic.
When people understand what the instructions are and then they don't do them. Specifically, I'm usually talking about skin conditions, and even more specifically, I'm talking about ear infections. So a dog keeps getting ear infections because they can't keep from giving it string cheese and stuff. And so I'm like, okay, lady, I mean, this is your fourth time here for this. This conversation may actually go like this, by the way. And I said, you keep spending money over and over on the same thing. I said, I'm just taking your money home to my wife. I said, and that kind of takes a smile off their face. Although it puts it back on when they figure out I'm just BSing.
Yeah.
But I'm like, yeah, just take my, and then Sharon's heard me say that before. She said, you never bring your money home to me. So you get your own money, sweetheart.
Yeah, she's remodeling her house right now.
Oh, jeez. Yeah.
For the 18,000th time.
Yeah. Oh, let a piece of wallpaper just start to turn up a little bit, and we got to get new wallpaper. Would ever happen to taking a piece of gum and tacking it back down so it stays? No.
Do you know why she's mad at me right now about her wallpaper?
No.
This might be inappropriate for on air, but that's fine. She buys this wallpaper that's supposed to be floral. It looks like it's floral. And she put new wallpaper up in your dining room. And I looked at it and I'm like, looks like a bunch of vaginas.
Oh, wow.
And I don't know if you've seen this or not, but once you see it.
It seems like I would have seen this, but apparently I didn't see this.
She's like, it's floral.
Yeah.
And I'm like, well, once you see it, you can't unsee it. And now everybody that I've told that to, they're like, oh my God, you're right. And you have to really look for it.
See, if I was in my 20s or 30s, this would not have gotten by me. But it gets by me now.
Now when you go home, I want you to go home and look at your wallpaper because I doubt you don't notice when she changes things. It takes you a good week or two.
No, and you're the dumbass that pointed this out. Now we got to get new wallpaper again. So this is.
And now she's like,
so I had to take this out of your inheritance.
So I told her she's picking up new wallpaper. I was like, hopefully it doesn't have genitalia on it. So that's why you're getting new wallpaper.
Yeah.
Sorry to be the bearer of bad news there.
Next one will look like donkey reproductive parts. So anyway.
It's floral.
And by the way, we get to do this.
Yeah, at the very beginning of every episode, we have to clap.
So it's synced in.
So they sync the.
But I can't make any noise because both of my hands have Dupin's contractions.
What is Dupin's contractions?
Oh, where the tendon's contracted like this. Now this really is not bothering this hand at all. I mean, I got sore fingers on this hand mostly because they've all been dislocated multiple times. But this one, I can only get that one down. So when I play basketball, I play I'm like Bart Simpson out there with.
Your hands look so gross when you do that.
3 fingers on each hand.
You have to watch the YouTube channel to see his hands on video, but hold it out for the camera to see. It looks bad.
Yep.
It's bad.
I don't have a single finger that hasn't had something happen to it. I take that back. I don't think either one of my thumbs have ever had anything done to them, but everything else. And by the way, this finger right here, this pinky on my right hand.
Yeah, it looks all crooked.
Yeah, it is all crooked because I've dislocated twice. But the original injury to that thing was I broke it in 8th grade. And,
doing what?
Playing softball out on at lunch hour.
Oh.
And my mother, bless her heart, came over and got me and took me to the doctor's office in Kalamazoo, Michigan, the Borges Hospital, and they had a little hospital out in front of it that an old guy worked at by the name of Homer Stryker. You ever heard of the Stryker Corporation?
Yeah.
Okay.
Wait, the Stryker guy was your doctor?
Well, for my broken finger, he was. He was born in Athens, which is only about 7 miles from our house.
No way.
Yeah.
I didn't know that.
Anyway,
no.
Yeah, so he fixed my finger. I'll have to tell you that.
So a millionaire? He took bajillionaire?
Yeah, he's a bajillionaire. He's dead now.
Fixed your finger?
Yeah, anyway, they took a pencil and put it in between 2 fingers and popped this back over the top, and it hurt.
Ew.
remember it hurt, and I thought, God, I didn't think an old man like this age could even hurt me. And he hurt me bad. And he got this finger all lined up, and then he bandaged it up, and he put a finger splint on it and everything. He says, I don't want you to take this off for 3 weeks. And I'm like, so I'm walking out of there going, okay, that's fine. Well, I didn't realize what the thing would smell like after 1 week.
Ew.
You know? And I started
smelling your.
This is terrible. This smells terrible. I'm in 8th grade, mind you, and you can't put enough cologne down the damn thing to overcome the stench. So I
just start wrapping your hand.
At that point in time, it would have been probably English leather, dumping English leather into your
gross
into the well pit there.
Ew.
Anyway, so I go to school and I go sit over on the right side of the room, and so my right hand would be away from all the other students because I thought the girls.
Yeah, you're not picking up any girls in 8th grade doing that.
With a hand that smells like that, I'm not. No, it's terrible. Yep.
Nope.
Yep.
And we were just talking about before this episode. We were kind of debating because we always debate on what we're going to do for our podcast topic. And I said, well, you see new shit every day, right?
I do.
Well, what have you told me a few things that just like blew my mind that I didn't even know existed.
Well, I had a cat come in this week, and it was an old cat, and it belonged to a woman, and it had a big jaw on the right-hand side, lower jaw.
What do you mean a big jaw?
I mean, this part of the jaw was really big and
like
large.
Muscle or like pus or like...
Well, there was pus coming out of the teeth. But
what?
Yeah, and the teeth had pus coming out because that cat had cancer in the jaw. Cancer of the jaw.
That happens?
Yep, that happens. Yep. Yeah, and believe it or not...
what do you go about fixing that?
Well, you don't fix that. That just... And she really didn't... This was an old cat. She didn't really have the money to take care of him. And so, she had the money to take care of him. We went ahead and gave him Convenia and a pain med and sent him home and said, when life is no longer pleasant for your cat, then we should do something. But I had one not long ago where they split the jaw. They took him up to Blue Pearl up in Grand Rapids, and they split the jaw right down the middle and then took that whole side of the jaw off. And
on a cat or a dog?
On a dog, this was. And then just cut it off.
Wait, was it cancer? Same thing?
That was cancer, bone cancer.
Why do they get bone cancer there?
Well, you got bones and you get bone cancer. So whatever bone you decide to get bone cancer in, that's the...
Wait, so this could happen anywhere in your dog, like legs?
Yeah, I don't think I've ever seen it. So I've never seen it in the skull. So it usually happens on long bones. If I was going to tell you, the tibia, sometimes the humerus. Sometimes I see it on front legs, but somewhat infrequently. So we see... And it usually is on big dogs that we see bone cancer. It's either chondrosarcoma or an osteosarcoma, and some of them are real aggressive, and some are kind of complacent and don't do a hell of a lot. We had a Dane, and we told the woman that she just needed to be able to control the growth of the cancer, et cetera, et cetera. And so she went up and got him a couple of injections for this, and gee whiz, we thought this thing would all be over in a couple of months, and she sat him 6 months after that, so we finally just amputated his leg.
Oh, geez.
Yeah, big Dane. But they
walk around okay?
We talked about
that.
So we talked about that a little bit. And said, well, I don't know how we get along on 3 legs. Well, by the time she came in at month 3, it's like, well, that's how he gets along on 3 legs. Fine, because he's walking on 3 legs.
You'd think that Great Danes, because they're heavier, they would have a harder time.
Well, you take a little of the weight off them when you take the leg off them. So you take part of the weight off when you take the leg off. And you take it up as high as you can.
Wait, reverse on the story. Was this a front leg or a back leg?
Back leg. Yep. So,
okay, I can see that a little bit more than a front leg because a lot of their weight is on the front.
Dog was happy.
Yeah.
Yeah. I mean, he got his leg off and it wasn't painful anymore. Hey, sleep through the night now. It took him a couple of days to get through the initial phase of it. But anyway, so this cat had cancer of the jaw, and it's going to be a life-ending thing. Although if you got a lot of money and you want it, it isn't like you want a cat, you want that cat. You can take those jaws off, right? The symphysis there, go all the way back, and then take it off on the back here, and then they have a hard time eating and stuff a little bit, but they figure out how to do it.
You lost me at pus coming out of the teeth.
And believe it or not, the last one I sent up there to have that done, it was one of our ex-students that took it off.
Really?
Yep.
Holy cow!
Dr. Jones, who lived in Battle Creek here, and
really,
yeah, she was up in Grand Rapids now, and. She's gone well beyond us. She's cutting off cat jaws and dog jaws now. So
good for her.
And apparently she's done a lot of them. And I love this kid. I love this kid. She went down. She had a job. She had a scholarship to swim at Indiana, so she got the first 4 years done for free. at Indiana, and she came back and applied to vet school and got into vet school and then did vet school and then worked Monday through Thursday, 4 days a week. And then on the weekends, got a job working at an emergency clinic apparently, and then took all her money from the Monday through Thursday and spent that money on Tide and Hamburger Helper and stuff like that. Yeah, she lived on that money. And then she took all the other money she made and paid off her debt. So I think she worked 2 years in emergency clinic every weekend, had it all paid off.
That's awesome.
So she's free and clear now. So she's like 30 and
debt-free.
And debt-free, yeah.
That's
so
awesome.
she did that herself. But she was driven. I mean, she was driven to be that kind of a swimmer. She was driven to get in vet school. She was driven when she got out to pay off her debt. I don't know what the hell she's being driven in today, but she's driven. And
she's doing something.
She's doing something. I had lunch with a friend of mine today. We talked about that, hey, enjoy the trip. It's more fun than the arrival.
Than the destination.
Of which there usually is no arrival.
Mm-hmm. That's very true.
So the other thing I had this week, it was interesting. We had a dog come in yesterday, and he had blood in his mouth. I thought, this dog's got to have a tumor in his mouth or something, but we couldn't see.
What, like just constantly bleeding?
Yeah, he's blood all over the room and where he was bleeding and everything.
Oh.
And
I would think bit his tongue.
He's got a tumor, he bit his tongue, or he's got a growth in there. And I thought, well, this probably isn't usually chondrosarcoma because chondrosarcomas, they usually don't bleed, or,
what's a chondrosarcoma?
Those are bone tumors, osteosarc and chondrosarcoma. And
how do those bleed? What makes them bleed?
Well, I'll tell you, this dog had an autoimmune disease called thrombocytopenia.
What?
Thrombocytopenia.
Thrombocytopenia.
Yeah, it's an immune-mediated disease where the dog takes its own white cells and whacks the snot out of the platelets, which are part of the clotting mechanism.
Okay.
Idiopathic thrombocytopenia. Idiopathic means we don't know why it happened, but it's immune-mediated. So all of a sudden, this dog woke up one day and decided, I got some cells in my body, I'd like to whack them all. And
it just happens randomly.
It happens randomly.
Is it genetic?
No, I don't believe it's genetic. This dog had a temperature of 103, and of course we anesthetized him, and then we saw where he was bleeding out beside his teeth, everything. When we looked at his stomach, he didn't have any clotting going on in his abdomen. In other words,
no internal bleeding.
Teeny tiny little hemangios.
What are hemangios?
Where you're bleeding into bleeding onto your skin. It's in other words. This dog had a fairly aggressive looking lesion in its ear, but that, I think, that whole thing was from thrombocytopenia. So this dog it had no clotting time now. So when it bled, it just bled. This would be like if somebody ate a lot of rat poison with warfarin in it. Same thing. You're bleeding. You stop one of the processes and one of the steps in clotting, and now you're not clotting and you're losing. This dog had lost some blood already. So we gave him a big whopping dose of dexamethasone to, it's an immune-mediated thing. So you give him immunosuppressive dose of dexamethasone, which is steroid.
You can't fix it though, can you?
Yeah. Sometimes if you just suppress it long enough, it'll forget who it wanted to whack.
Really?
Yep. Now you have to be careful. What you do in this thrombocytopenia thing is, and even for young veterinarians, you always want to take it off too soon. No, don't take it off too soon. You got to stay on something, some low dose of steroids when you get up there, or azathioprine, or there's a couple other drugs. What's the drug we used yesterday? Oh, I hate this part.
Regardless, people like me aren't going to understand what kind of drug it is.
Anyway, so you put them on an immunosuppressive drug, azathioprine, steroids, dexamethasone, which is a steroid. You give him a big whopping dose, and then I told him to go out and buy a thermometer tonight. And if the temperature comes down to 100, he'll know the immune process is probably slowed down enough for this dog to accumulate more platelets. This dog was releasing platelets, but the platelets are only lasting about 45 minutes. They get destroyed by the body. So,
wow. Wait, could this ever just sporadically happen again?
Yeah. In fact, with this dog, it could happen again. This dog was like 11. So it may not happen again, but probably this dog would be on immunosuppressives till the end of his life.
Well, that hurt.
If he survives this. Okay.
Oh, so it's an if.
It is an if. Yep.
Oh, what's the survival rate?
I don't know. It's a little bit like Las Vegas. The cards are there. They just haven't been turned over yet.
Mm-hmm.
Yeah. I think
That's wild.
yeah. That's the world I live in. You know,
Did
you
it
know
ever
how the last 10 turn. I just don't know how number 11 is going to turn out.
Did this ever stress you out when you were younger?
Oh yeah, I worried about it. I mean, you do what you can do, and once you do what you can do, there isn't much left you can do.
Yeah.
And so, one of my friends' dog died of this. You know, and so
What is this common?
Yeah, it happens. I mean, I would tell you at any one time, there's probably one or two active or inactive thrombocytopenia patients in your clinic. I had a woman that had a little chihuahua that had it, the chihuahua. And the chihuahua went years without having a relapse and had a relapse after 3 or 4 years.
Why are the teeth bleeding though?
Well, that's where the dog decided to bleed. It could have bled into its bladder. Could have bled into its bowel. Could have bled.
What if it would have done that? They wouldn't have known unless like the dog.
Well, they had black stools.
Yeah.
And it'd have been.
What about people that don't check their dog's stools? They let them out in the yard and they just.
Well, they start to get weak and they start to get pale. So I had that yesterday. I had a dog that a gentleman came in with that was losing weight. And I don't see this very often either. It had whipworms, too numerous to count, and hookworms, too numerous to count. So that's right. Boy, he had diarrhea. I haven't seen that in years.
Hookworms and whipworms?
Yeah, and
especially this time of year.
And the whipworms, so the hookworms are up in the small bowel.
Really?
Yeah, and they're bleeding the dog out of the lining of the bowel, and then the whipworms are causing chronic diarrhea. So, and this dog, I looked at the blood picture on this dog, and I had just a barely low albumin. Well, that dog was losing so much blood through its bowel. In other words, it was all being. It had lesions, and it was leaking albumin into the bowel, leaking it. The liver kept trying to make it, leaking, kept trying to make it. Dog stayed ahead of everything, but had lost weight and everything. So we figured that out yesterday.
This would stress me out.
Yeah, so we checked it. We did a 4DX, checked it for Lyme or Leaky and all that sort of stuff, and then did the chemistry profile. The only thing that was even remotely low was the albumin. It was 2.4, I think, or 2.5. It was pretty close to being too low. So I thought, well, maybe this is lymphangiectasia, which is a protein-losing enteropathy. No, it wasn't that. That's what I would have bet my money on yesterday. I'd have lost. Mm-hmm. That's why when I go to Las Vegas, let's just go back to the room when the meetings are over.
Hey, we won money last year.
I know. Did you want to tell them that story? That was kind of a funny story.
I don't know why.
We went and got something to eat, and then on the way out of there,
we got Shake Shack.
I want to Shake Shack now.
That was your choice. I wanted to go somewhere else, and you're like, we're going to Shake Shack.
Yeah. Better choice.
Yeah.
Anyway.
We were walking back, and I don't know why I don't ever play slots.
Well, you told me you like to play the
Wheel of Fortune. I said that's the only one I play, and I said, and I don't always play it. I just play it when I feel like I want to play it. And we walked back, and I looked at it, and I said, give me $20. And I don't know how many times I hit
$20?
You gave me $20. You said no at first. You said, no, I'm not giving you $20.
Who pulled the wheel, me or you?
I did. I sat down and I said, no, I want to play. And you said something about you got to pay me back for the $20. Okay. And I was like, okay. And how
the
many?
Last name's Van Vranken.
Yeah.
Van Vranken.
Dutch.
Or McTavish. You're going to borrow money from McTavish or Van Vranken. You're going to have to pay it back.
You're going to always have to pay it back.
Yeah.
So anyway, I pulled it how many times?
Twice.
$800.
Yeah.
Was it 800?
No, it was like 400 or 500, and then so we went and we said, well, let's not be stupid. Let's just take our winnings and go home.
Yeah.
So we took our winnings and we walked out of there, and there was a smaller Wheel of Fortune one. So we pulled that once or twice and got $275 out of that.
No, that was at the airport, I think.
No, we got $80 at the airport. Played the damn thing 3 times, and every time, none of the times did we ever have to pull it more than 2 or 3 times, and it paid off. So,
that was wild.
Yep. So, and I know there's gamblers out here listening to this, and they're like, well, you dumbass, you should have been pulling stuff all weekend. And I'm like, yeah, probably should have. But
no, every single time after that, I've lost.
Yeah.
It was just like that one, I felt it, and I was like, $20 in this machine.
And you didn't we didn't spend the whole thing. We didn't even pull the end. We didn't even pull the crank till the end.
I could have sworn we won more money. I thought it was like 800 or something.
Well, by the time you counted it all up, it was like 475 and then 275. And so it came, and by the time we won the $80 at the airport, it was $800.
Yeah.
And we didn't spend hardly any time doing it. So that's supposed to be the fun part. You're playing. We didn't play very long. We just played and won and went home. And kind of crazy.
That was crazy.
Yeah.
That's fun though.
Yeah.
So what else have you seen this week at your vet clinic?
Oh, that's about. I mean, I always have a lot of stuff, and just so clients probably ought to know how this works. You take a history, and I think that's kind of an art form, taking the history, how long has it been going on, blah, 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 blah.
And you always want to give a thorough history.
You want to get a thorough history and then do a thorough exam.
Same thing when you submit questions to Dr. Pete. You want to give as much information as possible.
Yeah.
Which we're going to do another question release probably pretty soon.
Yeah, and that shouldn't turn into Name That Tune in three notes for me. I should at least get to the chorus part, so I can give you an answer if we can get to the chorus part. So I can't name it in one or two notes, but I dun 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 dun. Okay, Louis. Anyway, yeah, that I can get.
That's funny.
That I know that. Anyway, that was a lot of fun playing blackjack and winning. But really, we're talking about Las Vegas. I mean, really, what we do in the exam rooms has a lot to do with Las Vegas. I mean, it's like, okay, you got all the cards. I just need to turn the cards over and see what they are. Mm-hmm. So I need to do a urinalysis, okay, and then I need to do a CBC, and I need to do a chemistry profile test, and so I'm turning it over. Yesterday, I had to do a fecal. So the guy had to bring a fecal in this morning. They sent me, 2 numerous to count whips, 2 numerous to count hooks. That's what's going on with that dog. And that dog with the 2 numerous to count whips, those dogs will get, they'll get a screwed up large bowel with diarrhea and everything. Mm-hmm. They'll look just like a Addison's dog. So you see those dogs with like that with diarrhea and stuff. So Addisons are where your body, we just talked about whacking stuff.
Yeah.
And really what happens is in Addison's, you don't have any cortisol because the adrenals are never asked to make anything. Mm-hmm. So it's usually a lack of pituitary function.
Right.
Yeah. So usually the adrenals get whacked and they no longer respond to anything. So there's no cortisol. So you have to supply cortisol. And there's an injection you give every 28 days, works really good for that. There's also pills you can give every day also. But anyway, yeah. So you got disease that impersonate one another. I sometimes you'll see this disease and it's like this disease has been on Saturday Night Live because they got it all made up to look like Bill Clinton, or they got it all made up to look like Donald Trump. And so it looks like that when you look at the disease. It's not that at all. You have to turn the cards over. Mm-hmm. You have to turn the cards over.
Exactly.
And then you have to figure out what you're going to do to treat them. And then you have what they call the therapeutic trial part of it.
Yeah.
Okay, let's try this and see how it works. Let's try that and see how it works.
Yeah.
Let's try this and see how it works. So, you have all those things. And
you've been doing it for so long.
Yeah, I have been doing it for a long time. But
you mark your cards.
You can't be right. Yeah.
After 50 years, you become a good card counter.
Yeah. Well, I tell clients that too. I said, I like to mark cards. When I was a kid, I would cheat at playing cards when I played with my sisters. I like to win. And I still like to win. So when I'm treating dogs for this or cats for that, I like to win. I want to win.
That's right.
And then if I have to, I'll mark like you take your dog back. You have that little dachshund. Mm-hmm. They react to vaccine badly sometimes. So
you always give Benadryl.
I give Benadryl before you take your dog back for a DHLPP.
I think one time we didn't do it because I think you brought the vaccine home.
Oh, I think I do it every time.
No, I think you said can you give them like the Benadryl pill?
Orally, yeah. 1 milligram. So clients are going to do this. You give them 1 milligram per pound. If you got a 25-pound dog and you don't want it to have a vaccine reaction, tell the veterinarian you're going to give them Benadryl.
So there was one time that we did it that I think I was trying to give her the pill and she wouldn't take it. I was like, whatever. What's the worst that can happen? And that bump on her back stayed.
Yeah, for a
while. I thought it looked like a little tumor.
So that's one of our mantras, with who do we give Benadryl to? So we give it to every little white dog. If you have a white dog, it's under 20 pounds, it gets Benadryl. If you have a dachshund and it's under 100 pounds, you give it Benadryl. That's a joke because they really aren't that way. But if you have a dog with a pushed-in nose, a brachycephalic dog, less than 20 pounds, Boston Bulls, Bugs, yeah, they get Benadryl. You have a dog that weighs under 10 pounds, they get Benadryl. So that's four groups of dogs: little white dogs, dachshunds, dogs with their nose pushed in, any dog less than 10 pounds. They all get that. And you don't have to wait either. You get the Benadryl, then you get the vaccine. And it never seemed to have any problems at all. The antihistamine and the histamine tend to show up about the same time. So if you're going to have a reaction. You may have a slight reaction. The problem is you can't have a reaction and come back in the doctor's office. The histamine's already been released.
Mm-hmm.
What's the term? Release the dogs.
Release the hounds.
Yeah, release the hounds. So once the hounds are released, then they're released. So you can't stop that. You can just stop further once. Any more of it from happening. And usually we give them dexamethasone and try to stop. Stop reactions. But anyway, so those are my
mark your cards.
those are my interesting cases. We had the dog that was bleeding out of the gums. We had the dog that had
you lost me at the pus out of the gums.
The cat that had
pus out of the teeth.
The cat that had a bone cancer of the jaw.
Ugh.
What's the other one I had? What's the other one I told you about? I can't remember. Yeah. That's what happens.
It's been a long day.
I can't remember because I'm old.
I can't remember because I have ADHD.
Okay.
Same, but different. All right. Well, you ready to get some outro music going?
Yeah.
Got anything else you want to say?
No.
I see some closing thoughts.
Yeah. Most of my thoughts are evil, so we'll let them close without opening.
Okay. We appreciate you guys listening along with us today. Yep. We hope that we've been able to share some information. What?
Well, next time I'll release all my evil thoughts. Okay.
Next time
we'll have an evil thoughts episode.
Okay. Deal. You're good at those.
Dr. Pete,
uncut,
uncensored
and uncut.
Yep.
I've seen you get censored on your radio show for saying things you shouldn't on air.
I never got cut off. I got questioned as to why the hell I would say that, but beyond that, I never got in a lot of trouble with the FCC or anything like that. So
we're gonna start a new show, Mr. Obvious.
Yeah, uncut.
You used to make me listen to that as a kid. Bob and Tom, the Bob and Tom show.
Yeah. Your mother disapproved of that.
She did. I wonder why. Because it's Dr. Pete's
Bob and
evil
Tom
thoughts.
They were hilarious, and Mr. Obvious was really funny.
Yeah.
Yep. Yeah.
Long time listener, first time caller.
Yeah. Thanks, Mr. Obvious. I never made the connection.
Well, we hope that we've been able to share some good information that will help you love your animals as much as they love you. Don't forget, always treat the treatable, prevent the preventable, and we will catch you on the next one.
With a few evil thoughts.